Let's discuss the 5 transporting points. Stomach 36, ZUSANLI, leg 3 miles. Location 3 June distal to stomach 35, lateral eye of the knee, and 1 finger breadth lateral to the anterior crest of the tibia on the tibialis anterior muscle. How to find? First, locate stomach 35, lateral eye of the knee at the level of the knee joint space. From stomach 35, palpate 3 June, 1 hand breadth down and 1 finger breadth towards lateral by placing the middle finger adjacent to the tibial crest. There, stomach 36 is located in a depression which can be palpated dynamically. Choose the point according to pressure sensitivity, or palpate the lower border of the tibial tuberosity and dynamically locate stomach 36 1 finger breadth lateral to it. Needling vertically 1 to 1.5 June. Moxibustion is often used on this point. Actions indication regulates the stomach, strengthens the spleen, transforms dampness, tonifies qi and yang, nourishes the blood and yin, calms the shen, opens the channel. Special features: Hosi point, earth point, bend point, 5 paces point, lower Hosi point of the stomach, Gao Wu command point for disorders of the abdomen, Madanyang point, sea of water and brain point, main point to tonify qi and blood for general weakness, very important point. Major point to tonify qi, blood, yang, yin, and the original qi, very important in all deficiency patterns of stomach and intestine. Strengthens the upright qi, sheng qi, and resistance to exterior pathogenic factors. Brightens the eyes for chronic eye diseases. Harmonizes nutritive and defensive qi and exterior invasions of wind to regulate the space between the skin and muscles. Resolves edema, raises yang for prolapse, expels cold with moxibustion, expels wind and numbness in painful obstruction syndrome, B syndrome. Earth point, Harari point, 7 to 9 a.m. Seasonal Harari point, late summer Hosi point, antique autumn point, point of sea of nourishment, 1 of the 9 needles of returning yang, greater influential point for the stomach and abdomen, lower Hosi point of stomach, Amadanyang heavenly star point, divine objectivity point, immunization point, use moxa daily. Center reunion, particularly point of energy, vitality, and longevity point, stimulates parathyroids. First aid point, nausea, abdominal disorder, food poisoning, travel sickness, morning sickness, acupuncture blackout, if the needles are in the upper body. This is one of the major points in acupuncture and can be considered for many diseases as well as for preventive treatment. It shakes up and nourishes all the officials. It is connected to all the Cs. It revitalizes all the energies. It revitalizes the entire body and mind. This point is restorative and is used to bestow longevity and endure in old age, as well as being effective for declining eyesight at this stage in life. Strengthens nutritive and defensive qi and thus the immune system. Helps keep us free from disease, steps up with white blood cell count when used with moxa, helps to enhance, strengthen, and stabilize the earth. Consider for nausea or abdominal disorders, press with thumb for 4 to 5 minutes to bring up general energy level. One can moxa 7 to 20 times. For any lack of disease and disorders such as lethargy, weakness, especially after a long illness, coldness, or chronic depletion of energy levels, for nervousness or extreme agitation, helps to lower blood pressure. In the classic, it was observed that when used after the age of 30 can change a person's whole way of thinking. The author's personal experience of its effect accords with this Ming Dynasty documentary. Thank you for your attention.
Let's take up gallbladder 1, TONGZILIAO. a point of the eye system. GB1 is located in a bony depression on the lateral aspect of the orbital margin on the level of the outer canthus of the eye. How to find? From the outer canthus of the eye, palpate in a lateral direction. Locate GB1 on the outer aspect of the orbit, diagonally inferior to the temple, where a bony depression can be palpated. TB23 is located more superiorly on the lateral end of the eyebrow in a depression on the frontozygomatic suture. Bladder 1 is located at the inner canthus of the eye. Needling, 0.2 to 0.3 tune obliquely in a posterior direction or up to 1 tune transversely subcutaneously towards EXHN5, the Taiyang. According to some texts, Sebastian is contraindicated. Actions, indications, expels wind and heat from the eyes. Special features, meeting point with the SI and TB channels. Entry point. GB1 expels wind, clears heat, brightens the eye, so good for eye pain, itchy eyes, redness, swelling, and pain of the eye, lacrimation on exposure to wind, redness and itching of the outer canthus of the eye, myopia, blurred vision, diminished night vision, deviation of eye. Subdues liver yang for headache, dizziness. GB1 is an important local point for a wide range of eye problems. It expels wind heat and is used for conjunctivitis from an exterior attack of wind heat. It clears heat and is therefore used as a local point for eye problems caused by liver fire, such as red, dry, and painful eyes, which may occur with iritis, keratitis, or conjunctivitis. It is also widely used as a local point for migraine headaches around the temple and outer corner of the eye due to rising of liver fire or liver yang. Its ability in treating headaches is also due to its being a point of the eye system. The eye system starts from the convergence of channels around the orbit of the eye and it enters the brain. GB1 is traditionally indicated for pain, swelling, redness, and itching of the eyes, lacrimation and disorders of vision, and in modern times for such disorders as glaucoma, photophobia, cataract, nebula, corneal opacity, keratitis, retinal hemorrhage, and atrophy of the optic nerve. It is also commonly used for temporal headache and supraorbital pain, especially due to the etiologies that were mentioned, as well as for deviation of the mouth and eye due to exterior or interior wind. Interestingly, GB1 is included with SI1 in a classical prescription for breast pain in women. This reflects the pathway of the gallbladder sinew channel to the breast. GB1 is an entry point. A branch from the primary meridian makes connections with stomach 5, stomach 6, stomach 12, and SI18, and in doing so, it crosses the triple burner meridian. Consider GB1 for many types of eye disorders. Early stages of glaucoma, conjunctivitis, photophobia, and also facial paralysis. Helps with clarity, vision, and decision-making of the body, mind, and spirit, strengthening resolve and self-assertion if timidity is present within a person. The gallbladder is an extraordinary food. It works with only what is pure, clear, and with the essences. It is responsible for what is just and exact. Determination and decision are said to stem from it. The special place of the gallbladder occupies not a zang, although it stores essences that are used within the body, and not quite like the other food, because it has no contact with the exterior or directly with food, gives it an in-between position. Is reflected in the course of the meridian. Its connection with triple burner, as Shaoyang, is also a pivoting or hinged position. Given its role as the upright official of decisions and judgment, orbit bone is an ideal vantage point for the superficial gallbladder meridian to start. In order to arrive at a decision to act, you need to be able to assess your surroundings and look around. Pivot before acting, you need to be flexible to consider alternatives. Then, at the moment you determine to act, having marshaled all your forces, you concentrate all your being and mentally look straight ahead without further hesitation. This capacity to act comes from the gallbladder's association with the beginning of things, spring the movement of life to unfold, and with its ability to force a passage and to bring together and organize the other officials. The chi of the gallbladder is firm and direct. All this action needs to be well rooted in yin, in calm and equilibrium if it is not to become overexcited with the yang, the Shaoyang of its nature, and lose control over the emotions. Through its connection with the triple heater, Shaoyang, it is a connection with the Yuan Qi, the Qi of the origin. So the gallbladder works from the depths to the heavens, working with pure essences and helping to provide a place for the Shen. Its responsibility for what is just and exact, together with this connection with the origin, means it determines in good health a strong and virtuous direction for one's life while remaining imaginative, flexible, and tranquil. Here at GB1, you have the two aspects of the wood element, the gallbladder, the upright official of decisions and judgment, and the liver, the planning official. The liver is responsible for nourishing and energizing the eyes. Both are essential for vision and planning. If one's sleep is fitful with vivid dreams because the hun are disturbed or one has a headache, it is hard to make sound, creative decisions, whether rational or intuitive. This point can be used to promote clarity and vision at all levels of the body, mind, and spirit. Gallbladder timidity, when one lacks the courage to decide, make judgments, grow and assert oneself, when indecision and uncertainty plague one's life, can be assisted by this point, which captures so much of the essence of the gallbladder. Look at another way, myopia at any level can make one hesitate to act. The point is named for its location in the depression on the lateral aspect of the orbit bone, and many of its functions are connected to local use for the eye. The gallbladder meridian, as well as its own symptomatology, is frequently used in treatment to relieve symptoms from disharmony in its yin partner within the wood element, the liver. The gallbladder meridian is said to be the pathway for the rising qi of the liver. This can be seen, for example, with migraine, which often follows the GB pathway and for which a GB point might be used to send the qi downwards away from the head. The GB meridian, as the more yang aspect of wood, also has many points which disperse wind, to which the liver is averse, whether internal or externally caused. GB1 expels wind and wind heat, and can be used for redness, painful swollen eyes, and itching from an invasion of wind. It clears fire and is a local point for eye problems caused by liver fire, such as red, dry, painful eyes. GB1 is used locally for migraine headaches or pain around the lateral aspect of the eye or temple from liver yang or liver fire rising. When an attack of wind has led to facial paralysis affecting the eye and mouth, the deep pathway connection with stomach 5 and 6 make this a useful point. Thank you for your attention.
Let's discuss extra point. EXUE4, back of the middle finger, MUE24, stiff neck. Location, as the name implies, on the dorsal aspect of the middle finger in the center of the transverse creases of the proximal interphalangeal joint. How to find? Slightly bend the PIP of the middle finger. The point is located at the vertex of the flex joint. Located in a comparable position on the little finger is EXUE6 in the center of the proximal PIP of the little finger. Also located in a comparable position is EXUE10, 4 points on the palmar aspect of the fingers of each hand, in the center of the creases of the PIP joints of the second to fifth fingers. Needling, prick to bleed, or moxibustion. Actions indications, descend stomach chi, clears heat. Location 0.5 to 1.5 June anterior to the auricular lobe. Indications, deviations of the eye and mouth, ulceration of tongue and mouth. Method, puncture obliquely 0.5 to 1 inch. MUE24, stiff neck, location on the dorsum of the hand in the depression just proximal to the second and third metacarpophalangeal joints. Location note, MUE24 is usually located and needled with the hand resting in a loose fist. This point may be located at the apex of an equilateral triangle formed by this point and the prominences of the metacarpophalangeal joints of the index and middle fingers. The point is also defined as lying on the dorsum of the hand opposite P8. Needling, perpendicular or oblique insertion directed proximally 0.5 to 1 tune. Actions invigorates qi and blood in the neck region. Indications: stiffness and pain in the neck, inability to turn the head, headache, pain of the shoulder and arm, pain of the epigastrium, diarrhea, acute and chronic childhood fright, wind. Commentary: MUE24 is commonly selected for acute pain and stiffness of the neck. The point on the affected side is manipulated while the patient asks to flex, extend, and rotate the neck. Thank you for your attention.
Let's discuss triple burner 10, Qianzheng, heavenly well, a Jose point. TB10 is located on the lateral aspect of the upper arm, with the elbow flexed in a depression approximately 1 tune proximal to the olecranon. How to find? This point is best located with the patient's elbow flexed to 90 degrees, which will reveal an easily palpable depression 1 tune superior to the olecranon. TB10 is located in this depression on the tendon of the triceps brachii muscle, needling up to 1 tune vertically or obliquely in a proximal direction. Actions, indications. TB10 transforms phlegm and disperses accumulations, regulates and descends the qi, calms the shen, clears heat from the channel, opens the channel and luvo-connecting vessels, alleviates pain. Special features: Jose point, earth point, sedation point. Resolves phlegm, dissipates nodules for scrofula, coughing of phlegm, subdues rebellious qi for chest pain, cough, pain in the lateral costal region. Calms the mind for manic behavior, sadness, fright, palpitations. According to the classic of difficulties, the sanjiao is the pathway of water and grain. The sanjiao, therefore, is the passageway for food and fluids throughout the body. When fluids stagnate and condense, whether due to stagnation of liver qi, condensing action of heat on the body fluids, or deficiency of any of the 3 zang responsible for fluid transformation and transportation, the lung in the upper jaw, the spleen in the middle jaw, and the kidneys in the lower jaw, phlegm will be generated. Sanjiao 10, the Jose and earth point of the Sanjiao channel, has an important action on transforming phlegm and is indicated for a variety of phlegm patterns, including scrofula, coughing of phlegm, and psycho-emotional disorders. The disease known as scrofula, in which nodules appear on the side of the neck or in the axilla, always involves phlegm combined with either with stagnant qi or heat. Sanjiao 10 is traditionally indicated and included in various classical combinations for the treatment of this disease. According to the classic of difficulties, Jose points are indicated for counterflow qi. The Sanjiao channel enters the chest at Ren 17 and Sanjiao 10. The Jose point of the Sanjiao channel is able to regulate rebellious qi and transform phlegm in the treatment of coughing of phlegm, chest painful obstruction with heart pain, and coughing and vomiting of pus and blood. TB10 is earth point, sedation point, Jose, antique autumn point, upper meeting point, serene tranquility point. This point regulates and enriches the earth within the fire. Heavenly well can have far-reaching repercussions for the other 11 officials, bringing stability, strength, and serenity to a volatile patient who may be suffering from hysteria, anxiety, sadness, or depression. This is one of the most neglected points of the whole body, a magnificent point. No negative actions emanate from this well. Deals with all types of pain. Son screams because mother is sick, mother screams because son is sick. For pain in the jaw, hand, or arm, chest, rib, shoulder, elbow, or behind the ear. Consider adding this point when using triple burner 2 to ensure the earth is not dried out. Said to be supportive in cases where the patient has suffered a chronic lack of love during childhood, and to be effective for lack of appetite, as it has an influence on the digestive system via the Shang cycle. As a Jose point, heavenly well or triple burner 10 is dynamic and stimulating and can activate, smooth, and take deeper the flow of qi and blood in the meridian, and so is much used for P patterns, transforming phlegm, damp heat. It is used to dislodge pathogens, stuck in joints and meridians, nourish the sinews, relieve spasm, and help clear the skin. Pulse points regulate the flow of qi between the exterior of the body and the zan. The qi leaves the command point area to unite with the deeper qi of the body and ultimately the zan, which they help to regulate. The association with the earth element and being indicated for the bowels makes it particularly useful for treatment of disease of the stomach and bowels. Pulse points regulate the distal and proximal ends of the meridian and correct counterflow qi. To reach here, the qi has had to negotiate the large hinge of the elbow. It now has to make the ascent of the posterior of the arm. This point and the next few all activate the meridian and can be useful points to consider if the three-heater is sluggish, used for local problems of the elbow and other meridian problems. Thank you so much for your attention.
Let's discuss the small intestine channel, divergent. Pathway, the small intestine divergent channel separates from small intestine primary channel at the shoulder, depending on the school of thought in the area of small intestine 12 or in the area of small intestine 10. Descends downward the axilla and continues to GB22. Penetrates the thorax and spreads in the heart, where according to most authors, it forms the fourth confluence, penetrates the diaphragm to connect with its pertaining food organ, the small intestine. Clinical importance: strengthens the relationship between the heart and small intestine. It provides an explanation for the pattern of heart fire transferring to the small intestine and bladder. The small intestine divergent channel separates from the primary channel of the shoulder, enters the axilla, crosses the heart, and descends to the abdomen where it connects with small intestine. The small intestine channel of the hand tai yang is ascribed to fire and is interiorly exteriorly coupled with the heart channel and paired with the bladder channel of the foot tai yang, according to 6-channel theory. As far as the small intestine channel pathways are concerned, it is worth noting that the primary and divergent channel connect with the heart. The primary and sinew channel travels to the posterior aspect of the shoulder, while the Lu connecting channel connects with the LI15. The divergent and sinew channel connects with the axilla. The primary channel connects with the scapula, and the sinuous channel surrounds the scapula. The primary and sinuous channel connects with the neck, cheek, outer canthus, and ear. The primary channel also connects with the inner canthus. The sinuous channel connects with the mustard process, the teeth, and the corner of the forehead. It is by virtue of the small intestine status as a fire channel, it links with the heart and bladder channels and the pathways of its primary and secondary channels that may of the actions and indications of the points of the small intestine channel can be explained. Okay, this can be summarized as clearing heat from the pathways of the channel and reducing fever, especially malaria fever, points SI1 to SI4, assisting in transforming phlegm and clearing heat from the heart sum, especially in the treatment of mania disorder, SI3, SI5, SI7, SI8, cooling heat and fire and alleviating pain along the course of the channel in the arm, axilla, shoulder, scapula, neck, including mumps and throat and jaw, mouth, teeth, tongue, nose, cheek, eyes, and ears. Points of the small intestine channel are particularly indicated for swelling, mainly for the neck, throat, and cheek. Treating disorders of the breast, SI1, SI2, SI11, and lateral costal region, SI1, SI4, SI5, SI11. The meeting of the small intestine primary channel with the center of the chest at trend 17 can be part explain the action of these points on the breast, but there is no obvious reason why points of the small intestine channel should influence the lateral costal region. Note that even though the principal function of the small intestine food is to receive, transform, and separate fluids, The only indication relating to this function are dark and hesitant urination, SI2 and SI3. Even more notably, despite the fact that the channel connects with the diaphragm and stomach passes through REN12 and REN13 and descends to the small intestine, no points of the small intestine channel are indicated for disorders of the digestive system. Thank you for your attention.
Now let's discuss heavenly star points of Madanyang, Heart 5, Tongli, and Lung 7, Liech. Heart 5 is located one-soon proximal to the ventral wrist joint space, the most distal transverse wrist crease, on the radial side of the tendon of the flexor carpi ulnaris muscle. How to find? Position the forearm in a relaxed position, in a relaxed fashion. The location of the ventral wrist crease is variable. Therefore, the proximal border of the pisiform bone provides a more reliable landmark. Heart 7 is located on the wrist joint space, radial to the distinct tendon of the flexor carpi ulnaris muscle. Locate Heart 5, one-soon proximal to Heart 7, also on the radial side of the tendon. Located along a line on the radial aspect of the tendon are Heart 6, 0.5 soon proximal to Heart 7, and Heart 4, 1.5 soon proximal to Heart 7. Lung 8 is also located 1 soon proximal to the ventral wrist joint space, but on the radial aspect of the forearm. Needling vertically 0.3 to 0.5 soon or obliquely 0.5 to 1 soon in a proximal or distal direction. Caution, needling may be painful. Actions, indications. Regulates and strengthens the heart chi, the main point, and the heart rhythm. Calms the shen, benefits the tongue, benefits the bladder via the Tai-Yang channel, opens the channel and Luo connecting vessels. Special features, Luo connecting point, the Madanyang heavenly star point, main point for regulating and strengthening the heart chi. Calms the mind, so for sadness, mental restlessness, anger, fright, depression, agitation. Tonifies heart chi, palpitations, weak heart chi. Benefits the tongue, loss of voice, aphasia, stuttering, stiff tongue. Benefits eyes and head, red eyes, eye pain, red face, headache, dizziness. Regulates the uterus, excessive menstrual bleeding, benefits the bladder, and uresis. Heart 5 was included by Madanyang, the great physician of the Jin dynasty, among the 11 heavenly star points, his grouping of the most vital acupuncture points, and was indicated by him for inability to speak despite a desire to do so, vexation and anger, pounding of the heart. When excess, there is heaviness of the four limbs and the head, cheeks and face are red. When deficient, there is inability to eat, sudden loss of voice, and an expressionless face. Heart 5 is junction point, audacity point. This point enables a deeper connection to be made with the patient. Being the junction point, it communicates with SI. In doing so, it harmonizes these two officials and brings in the discriminatory influence of the SI to maintain the heart's virtue and thus the mandate of heaven. Connects to the tongue and eye for stuttering and speech disorders, palpitations, neuralgia, or spasm of the arm. Helps to see further beyond the mask, enables the patient to be more in touch with their real self. A peaceful point that gives strength and stability to a person shocked or traumatized. Aids clear thinking and communication. Helps maintain emotional harmony. Next, we go to Lung 7, Liech. Location. On the radial aspect of the forearm, directly above the thyroid process above the styloid process of the radius, approximately 1.5 soon, proximal to the wrist joint space or wrist crease in a V-shaped groove. How to find? Place the palpating forefinger on the anatomical snuff box. From there, glide proximally over the styloid process of the radius and locate Lung 7, where the finger can palpate a cleft between two tendons, brachyradialis, abductor pollicis longus. Or, using the tiger mouth grip, spread the thumb and forefinger of both hands, crossing them so that the forefinger of one hand comes to rest on the styloid process of the other, but avoiding bending the wrist. Lung 7 is located directly below the tip of the forefinger in a V-shaped groove. Needling. Lift the skin above the styloid process by pinching it. Insert the needle 0.5 to 1 soon obliquely and proximally, reducing or distally tonifying. Caution, cephalic vein. Actions, indications, supports the occiput and head, releases the exterior, expels wind, descends lung qi, opens and regulates the renmai, regulates the water passages, opens the channel and luo connecting channel, alleviates pain. Special features, luo connecting point, opening point of the renmai, Madan Yang heavenly star point, Kao Wu command point of the occiput, exit point. Lung 7 releases the exterior to expel exterior wind. Sneezing in allergic rhinitis affects the head for headache, treats the effects of worry, sadness, and grief, affects menstruation with kidney 6, affects the bladder, and opens water passages for urinary retention. It may make qi rise to the head to treat sadness and poor memory, affects the large intestine and defecation for constipation in the elderly. Lung 7 was included by Madan Yang, the great physician of the Jin dynasty, among the 11 heavenly star points, and was indicated by him for one-sided headache, wind painful obstruction, and numbness of the whole body, obstruction of phlegm in the upper body, and lockjaw. The glorious anthology of acupuncture and moxibustion by the Ming dynasty author Kao Wu includes lung 7 among the 4 command points for disorders of the head and neck. In the Ode of the Obstructed River, the use of lung 7 is referred to as one of the 8 therapeutic methods. In this description of the application of the 8 confluent points of the extraordinary vessels to affect specific symptoms and areas of the body, lung 7 is indicated for disorders of the head region, rebellion, and blockage of phlegm and dry throat. Lung 7 is junction point or general junction point, exit point, opening point of renmai, coupled point of yin chao mai, heel vessel. This important point is similar in effect to spleen 21, as it is said to be a special junction point which affects all junction points. Lung 7 helps maintain rhythm, which is one role of the pull, and balance among all of the officials. Effective for problems of the mouth, throat, head, and nose. Considered for constipation or retention of toxins, both mentally and physically, often combined with LI4 and LI20 for this. Helps to enable the release of tears if suppressed by chronic grief and sadness. This point can be effective for heat and pain in the palm of the hand, tension in the chest disorders with heavy mucus or breathlessness. Thank you for your attention.
Let's discuss the ZUSANLI ghost point, PC8, Lao Kung Palace of Toy. Location in the center of the palm between the second and third metacarpal bones, slightly closer to the third metacarpal bone. How to find when making a loose fist, the tip of the middle finger will rest on P8 between the second and third metacarpal bones, slightly closer to the third metacarpal bone. Heart 8 is located more radially between the fourth and fifth metacarpal bones. Needling vertically 0.3 to 0.5 joule. Thinner needles should be used as needling this point can be painful. Actions, indications, clears heart fire, calms the shen, harmonizes the middle burner, clears the yin nutritive level, and cools the blood. Special features: yin spring point, fire point, bend point, 5 phases, ZUSANLI ghost point, exit point. Drains heart fire, heart pain, tongue ulcers, thirst, insomnia, agitation. Calms the mind in manic behavior, fright, anxiety, mental restlessness. Clears heat, cools blood, and promotes resuscitation in febrile disease at the nutritive qi or blood level, loss of consciousness, agitation, mental restlessness, delirium, cold hands, fever at night, dry mouth, coughing, or vomiting of blood macules. P8 is the most effective point on the pericardium channel to clear heart fire. Being the spring point, it is particularly dynamic point to clear heat. In particular, it has a specific effect in clearing tongue ulcers deriving from heart fire. In acute febrile disease, P8 clears heat and cools blood and is used for high fever at night and delirium. If heart fire condenses body fluid, it may generate phlegm. And when this combined with wind stirred up by liver yang, the resultant wind phlegm may give rise to epilepsy or wind stroke. The importance of P8 in the treatment of epilepsy and also mania depression is reflected in its inclusion under its alternative name of Ghost Cave by Sansi Miao in these 13 ghost points for the treatment of these conditions. A great point to really tonify the heart and heart protector to bring strength and renew vitality. As the power point on the fire meridian speaks of communication and purity in regions of fire. If joy, love, and zest for life had been crushed, or when the person can feel no love or emotional warmth and is depleted in spirit, weary of life, then balance of weariness is a wonderful restorative point. When the person needs a real boost, here is an abundant revitalizing point. Use within its horary season or time to access the full purifying potential of this point from the heart protector, encouraging it to radiate sparkle of spirit and appropriate behavior of fire in good balance. When the world has become dull and everyday life monotonous and gray, or this is how the person presents themselves. This point can create a spark, reigniting interest in themselves and in exchange with others, renewing interest in intimacy and conscious behavior. As Xing Spring and Fire Point, PC8 can clear heat and heart fire, especially tongue ulcers, fevers with delirium, mental symptoms involving heat, rumbling speech, easily angered. It can correct counterflow, rebellious chi affecting the stomach from pathways connection, particularly if heat is involved. Clearing heat from the blood makes it appropriate for nosebleed, vomiting blood. As one of the 9 needles for returning yang, it can restore consciousness. As the third ghost point on pericardium, Ghost Cave with its consummate fire qualities of illuminating, purifying, and guarding the presence of the Shen add to its importance. Local point for pain and stiffness of the hand. As the exit point of the pericardium, the pathway connects from here with the 3 heater. Far point, horary point 7 to 9 p.m., seasonal horary point, summer, exit point, yin spring, antique spring point, ghost point. This point brushes the ash of this fire meridian, allowing joy, love, vitality, and vigor to emerge once more to a patient weary of life. One of the most powerful points on the body, bringing elation, joy, and hope back to a person, especially if depressed or when very low in spirit. If the fire is deficient, the patient cannot share warmth or affection. This may result in their becoming cold, rigid, or miserable. Causes the energy of the heart to lift up. Helpful where a patient is experiencing excessive sexual fantasies or conversely impotence. Local point for pain and stiffness in the hand. There are 3 ghost points on this meridian, which further illustrates its role as protector of the heart, particularly in cases such as out of control behavior, mania, or some degree of possession. Consider the use of moxa here, but take care not to overheat. Thank you for your attention.
Let's discuss the pattern of spleen and kidney yang deficiency with cold for constipation. Clinical manifestations: difficult defecation, stools not dry, no bowel movement for several days, crampy abdominal pain, pale urine, pale face, cold limbs, feeling cold, tongue pale and wet, thick white coating on the root, pulse deep, slow, full, tight. If cold derives from yang deficiency, the pulse will be deep, slow, weak with a slightly tight quality on both rear positions only. Treatment principle: warm the yang, scatter cold, promote bowel movement. Points: Ren 6, Ren 8, kidney 18, bladder 23, bladder 25, bladder 26. reducing method in case of full condition with internal cold, or reinforcing method if there is yang deficiency. Moxa applicable in either case. Ren 6 with Moxa moves Qi and expels cold from the lower burner. Ren 8 with indirect Moxa cones on salt, scatters cold from the intestines. Kidney 18 expels cold from the abdomen and promotes the bowel movement. Bladder 23 with Moxa tonifies kidney yang. Bladder 25, Bakshu of the large intestine with Moxa expels cold from the intestines and promotes the bowel movement. Bladder 26 with Moxa expels cold from the intestines and promotes the bowel movement. Prognosis and prevention. Both acupuncture and Chinese herbs are very effective in the treatment of constipation. However, chronic constipation may take a long time to be cured. The more long-standing it is and the more the patient has resorted to laxatives, the longer it will take to cure. Thus, one should not be surprised if a case of chronic constipation of over 10 years duration takes more than 1 year to be cured. Obviously, it is very important to look at the patient's diet carefully and give appropriate recommendations. There is no point in giving treatment with herbs and acupuncture for constipation if the patient's problem is due to not eating enough fiber. Thank you very much for your attention.